So I'm in the school, I've been in the school for a while. The main area of my research, it's getting almost as sexy as Juliet's, but not quite. I work with the Ted Noss Foundation, which they began with the Wayside Chapel, which provides services for the community of King's Cross mostly. They are a treatment program primarily, but their main focus is on disadvantaged young people. So they provide treatment programs for young people with drug and alcohol issues, so they go into a therapeutic community treatment program. They also are involved with people from juvenile justice who get referred, and there's quite a large group of Aboriginal young people who are in their treatment programs. They're also involved with youth homelessness now, so there's possibly opportunities in working around that. And they run 2 street universities, which I'll explain briefly. So there's a number of projects that would involve working with Ted Noss, who are now a partner with a number of us who are here in the room on an Australian Research Council linkage grant. So there could be a project within the grant, but there could also be projects outside the grant depending on student interest. So we have our statistician Andrew Hayen, who we've pulled into this new and exciting area of research, and Patrick Rawston's also involved in the research work. So the linkage project is looking at the pathways of young people who go into and out of the treatment program. So we could look at a project around some of that data. So at the moment we've already got ethics approval to analyse the current data set that Ted Noss has been collecting since the year 2000, but the most sort of robust data we have is from 2009 to today. So a project could look at analysing 3-month outcomes from that treatment population and looking at what kinds of outcomes they may have around substance misuse, reoffending, because a number have been involved in criminal justice incidents, psychological wellbeing, family social functioning. So 3 months post-treatment they do a follow-up survey. So you can compare those that stay in the program for 30 days or more, or those who leave early. So a number of young people, unsurprisingly, come to treatment and then say, I don't want to be here. So comparing how they do if they stay versus don't. There's also a lot of other analyses that could be done with that data set, and we're currently doing one now with a major project student. And as others have said, you could do 6 units of credits, or depending on your program, you could do more. I think the good thing about working with Ted Noss is you can have some, you can go up and actually see what they do as well, and have some on the ground field experience to understand the program, as well as working with the data set. We're also quite interested in the possibility of someone applying for a PhD down the track. Even if you started out with a 6 unit of credit project, the larger Australian Research Council study, which is the more social science research funding agency, like the National Health and Medical Research Council, it's one of the major funding bodies. So we've got 3 years of funding for that project. And whilst we couldn't fund a PhD stipend or the costs of a PhD, that could be applied for with a scholarship with, I guess, some support from us in terms of referees and advising on an application, but we would have money to support some field costs. So that PhD study what we'd really like to have someone involved in is actually analysing what's called linked data. So the study's got three main arms to it. One is a follow-up of 400 young people over the 3 years, involving surveys at 12 months and an in-depth interview at baseline and 12 months. But we also have data back to 2000. It's about 4,500 young people, which we are currently applying to link to criminal justice and health data sets, both pre-treatment and post. So we can look at offending and health outcomes, hospital admissions, ED admissions, and so on, pre and post. So there's a lot of meat in there for a PhD, and you have the wonderful support of someone like Andrew and the team that I've listed there, who you could go and Google and find out more about. So it would be a PhD within the context of an existing project, which provides a lot of support for a PhD student. You don't have to come up, with your own area completely. You'd obviously shape what that PhD might look like. So there's a real possibility with a 6 unit of credit to move that into a PhD if you're interested. The other part of the work of Ted Noss Foundation is on the other side of the page, is they have a street university, and this is where it gets a bit more fun. So the street uni is a more youth development outreach type project, and they have a site in Liverpool in Speed Street, and they have another one in Mount Holyoke, Speed Street, drug and alcohol, and they have one, I know, it's just one of those, yeah. Really funny coincidences. And then they have another one in Mount Druitt. So this program provides community-based services and an interactive space for young people. So they offer a range of programs. They've got directors, mentors, facilitators, counselling, community development and so on. So some of the things they do if you're into breakdancing. So they've got breakdancing, they have homework support, street cooking, English classes. So it's kind of that stage before young kids really get into trouble. So if they're really in trouble, they potentially end up in criminal justice system or in a treatment program like the Ted Noffs program in Randwick, which is just up the road from the university. Before then, they are already getting in trouble potentially at school. They've been picked up for some minor offence but not charged. And so the street uni is like that sort of in between where hopefully if you can intervene early with these young people, you can stop them from getting into more serious difficulties. So that's what the street uni is trying to do. So the idea with this project would be to do something more ethnographic. So I do quant and qualitative, but mostly qualitative, and I teach the qualitative methods course. So this would be a project where the person could go and spend time and observe what goes on in the program, informally interview young people and people who are running the program and participate in some of the program activities, even leading some of the groups if you were trained appropriately. So if you're a break dancer, great opportunity. But it's something, doing ethnographic research really puts you right in the middle of a program. And I had a student who was a medical student who did this at Ted Noffs up the road, and he spent 3 months basically not living but spending a lot of time in the residential treatment program with young people, understanding what it was like to be in treatment and to see what young people were experiencing. And he got 2 publications from that work. So as with everyone, you know, we'd aim, if you did a 6-unit of credit project, to get a publication out of that work. So I've put my details, the UNSW Gateway, you can see what work I've been involved in and make contact, and any other of the team members talk to me first, but we can negotiate something around these projects if these aren't particularly what you're interested in. So thank you, and I hope to speak to some of you soon.